We do have a forum this morning, so I will call to order our September board meeting. I have an on-site packet today to review. In terms of additions and revisions to our agenda, we do have 2 executive sessions today that we will need to work into our agenda. We need to figure out the time right now, or can we fit those in as we move on? Okay, so we will have those executive sessions. And then in unfinished business, we did table licensure fee increase discussion at our finance committee meeting this morning, and there's lots of other items that are on the docket for the board review. So I'm going to propose that we remove that from our unfinished business for this agenda as well. Any other comments on the revisions that we need to know? So we'll take a motion.
Madam Chair, I move to approve the agenda as amended.
Second for Claire. Moved and seconded. Any discussion? All those in favor say yes.
Yes.
Anyone opposed? No. Any extensions? Motion carries. We do have announcements today. Okay, so in terms of announcements, stuff here. So I do want to welcome the 3 new board members that we have here with us today. Light of all things happening, I do applaud your willingness to give your time and your talents to this worthy cause to serve on the Kansas State Board of Nursing. So thank you all very much for being here and serving on the board. We do have a rich history that dates back to 1913. So I just want to revisit the mission and the vision. The mission of the Board of Nursing is to protect and promote the welfare of the people of Kansas. The vision is to uphold the highest standards and secure public trust. And our core values are integrity. We act with honesty, sincerity, and fairness. Transparency. We promote open and effective communication through the ongoing interchange of ideas and information. Respect. We understand each individual has an important role to play in achieving our goals. Collaboration. We recognize the value of involving key stakeholders in the decision-making process. And growth. We support continuous learning to advance individual and organizational development. So I am going to ask that each of you take the oath. KSA 75-4308 requires that the following oath from KSA 54-106 be signed by all state of Kansas appointed board members prior to serving on the board, which I think you all have signed it. But we also like for new members to recite the oath to office here at your first meeting. So I will have you all stand. Okay. So I would ask that you raise your right hand and repeat after me. I state your name. I do solemnly swear. That I will support the Constitution of the United States and the Constitution of the State of Kansas and faithfully discharge the duties of my office. So help me God. Thank you very much. That our new members of the Kansas State Board of Nursing have fulfilled or reaffirmed their oath of office and commitment to this important service they have so graciously volunteered to be a part of. So as part of the recognition and commitment to the board, we have your official board member lapel pin which symbolizes your dedication and commitment to protecting the public health of the citizens of our great state. And it may be worn at all of your board and nursing meetings and functions where we are representing our board. So then we'll give each of you those. And then there's also a nice, all of your notes. There you go. Thank you. And welcome. Thank you. Thank you. Do we have any other announcements? Any other announcements? So we'll move to the approval of minutes. Everyone should receive in your board packet. We have June 11th, 2025 minutes for review and approval, and August 8th minutes for review. So I'll allow a little time if needed, if you haven't taken a look at those, and then I'd be happy to entertain a motion.
Madam Chair, I move to approve the minutes from the June 11th, 2025 board meeting as written.
I second Kathy Goldsby.
Thank you. We have a motion and a second. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries. So move to, do we have any consent item? We do not.
Yeah, minutes.
Oh, I'm sorry.
I move to approve the minutes from the August 8th, 2025 board meeting as written. Second.
Second. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries. So we will move to our agency reports, and I will hand this over to you, Carol, Executive Administrator.
Okay, thank you, Madam Chair. You have mine under the staff report. That's where you should be able to find mine, along with all the other staff members here. First, I just wanted to bring to your attention, and I probably should have put this in your packet or something. Amy Height has been recognized as an American Academy of Nursing 2025 Fellow. That's absolutely great. And just to let you know, the newest group that she's part of represents 42 states, the District of Columbia, and 12 countries. Congratulations, that's great. Very well deserved, very good leader there. So that's great. All right, back to my report. It's been very busy on lots of levels here. You do have in your packet, I talked about this before, we would like to do a revision to KSA 741112, and that is a statute. That's the statute about fingerprinting, because we would like to add the language of advanced practice registered nurse in it. So we'll talk about that a little bit later, but I do have a copy in there. Also met with KDADS to gather more information about the LMHTs and the state hospitals for the Education General, and I did that. So she may be saying something more about that. As far as legislative engagement, that's probably been the busy part. I did provide office or information for an office space LPA that's evidently being conducted. The information they wanted basically is, were we using all the square footage that we're paying rent for? How much did we pay? And if employees were all brought back into the agency, would we have enough room, or would we have to do something different? Presently, we would probably have enough room. We might have to rearrange things a little bit, but, so I'm not sure where that's headed. You remember last year, there was a bill introduced to bring all employees back. Didn't really, I mean, it had a hearing, but that was it. So I don't know. They're gathering more information. Let's put it that way. I know Adrian's probably gonna talk a little bit more about this, but I was involved in the information security legislative post audit, one of several post audits that we've been part of, it seems like. But we do have the committee meeting next Tuesday on that, so. And let me see, I attended the legislative post audit committee meeting about the abuse, neglect, and exploitation registry, LPA, that should say LPA, not LPN, LPA. And that's on the agenda, so I'll talk a little bit more about that. And then a lot of time has been gathering information, presenting information, follow-up information for the House Committee on Government Oversight. There's been 2 committee meetings, July 29th and then Monday, September 8th, that we participated in. And our new 3 board members, we did something a little bit different as far as their orientation this time than we've done in the past. I developed an orientation manual, and actually we didn't get it done yet, but it will show up on all of your laptops because it's meant to be a reference. You know, you may come across something that you haven't had anything to do with, and you're like, oh, wow, I think I heard about that, but maybe I didn't. So anyway, I utilized that with them, so we'll kind of see if it's been helpful for them. And then I went to annual meeting and then the annual NLC meeting. And that's pretty much it. Doesn't sound like that. Obviously. Okay, thank you. Any questions or?
Once again, we do appreciate all of the hard work you do.
Thank you, Carol.
Thank you.
Okay, we'll move to Adrian, Director of Operations.
Sure. Thank you, Madam President, members of the board. You have my report. We've had another very busy quarter. A lot of things going on. We've had some various trainings for information technology as well as for the entire staff as a whole. Here about 2 weeks ago, we had NLC training for some of the new members and kind of a refresher for the existing staff. It was well attended. We had our colleagues from the Missouri Board of Nursing, some of their new staff came and joined us for that, and then representatives from NLC and NCSBN and Fred Knight, who's the attorney, contracted attorney for the NLC. And so they had a good couple days worth of information, a lot of discussion. We invited the AEGs as well and had a good discussion, I thought. I've been serving on various committees, the ITech committees, looking at, which is the Information Technology Executive Council. We're looking at Senate Bill 291 that's been assigned to review the IT consolidation effort for the state of Kansas. I put the links in your packet, just if you're interested in following some of the movement of that. It's still being reviewed by the consultants, and we're expecting a report, I believe, at the meeting this month, that's coming up here in a couple of weeks. So stay tuned. We're kind of following that. As you heard about the legislative post audit, we're going to talk about it more in detail at the in the exec session, but I did want to share what I shared in Finance and Risk Management Committee is that it was a pretty big effort. It took us a couple months to pull that information. The first set of data that we pulled was about 267 pieces of information, which could be anywhere from 1 page to 250 some pages in length. And then produced another round of about 125 with a total of 392 items that we provide the committee or the auditors. And so that included staff interviews, review of all of the information, those sorts of things. And you've probably heard, I've tracked my own time. I haven't tracked everybody's, but Last year, I haven't checked this year yet, but last year I spent 637 hours on information security related topics for the Board of Nursing. So we've put a big effort into it, and I did a little math that I shared for the committee. And if you took everything that we've produced and stacked it end on end, the top of the capitol is 304 feet, so you could go up and down at least 4.5, maybe 5 times with all the information that we've produced. So we're taking it very seriously. We have a good team, and it's not an Adrian thing. It's everybody, the IT team, the staff, our information security officers, you as board members. We really appreciate it for the new board members. I know you heard a little bit about it in the orientation. You should be getting an email, if you haven't already, on your board laptops that is a course that you need to take. It takes maybe, what do you say, maybe about an hour and a half. You can start and stop, so if you need to come back, but it'll give us a report out that it's been completed, and that is something we do have to turn in to the state to show. And everybody else, I believe, is up to date, so thank you for doing that. That made life a lot easier during the audit, so thank you for doing that. Probably the biggest thing that we're working on right now is the Evoke discipline investigative system. Evoke is the new platform. I liken it to going from like Windows 10 to Windows 11, but we didn't have a Windows 11 for investigative and discipline. So this is a new process for all of us, and Linda and Colton and all the folks. I've been a little bit pulled away here the past couple of months, so I haven't had as much chance to get in there and dig, but they're doing a really good job. I'm really pleased with the way it's coming. I think Linda's team is working really hard on it too. So we're real hopeful. With that being said, our licensing side of the software does go into life in June of 2027. And what that essentially means is it's like the same thing. You can't use Windows 10 anymore. You need to use Windows 11. It's that version of it. And we'll need to either move to the Evoke system for licensing or something else. And so we're going to be gathering information for the Finance Risk Committee, hopefully for December, to maybe get some ideas of what it might cost us to do that. And then maybe get a better idea of maybe if the state's going to allow us to do that. There's a lot of hoops we have to jump through, but in order for us to do these pushes and these new things that are being requested of us, we do need to upgrade at some point. And so I liken it to a vehicle with 300,000 miles. We've had it since 2009. I tell the story that, we've done all the upgrades and the security and that sort of thing, but it was, invented and designed before the iPhone existed. So the fact that it doesn't work exactly the way it shouldn't surprise anyone. So, but it is the version that we have. It has been upgraded, things have been changed, and things are being tweaked to increase performance and cybersecurity and all of that. So it's still a viable system, but we just need to really start planning. And it is part of the 3-year IT plan. I'll put that in the next packet. I had to submit that in year 2 somewhere. I forget what day I had to do it. Here recently, I had to submit that to the state. It hasn't been finalized or anything like that. They're going to compile it into a statewide IT policy. So I will put the link to all of that. Probably will be in the December meeting as well. But if you kind of want to detail, if you look at my report, you can kind of see the different things we've been doing in the different phases and those sorts of things. One nice thing that I just saw yesterday, we have surpassed 4 million images in our imaging system, which that doesn't, maybe to some people that's not a lot, but for somebody our size, that's a lot of stuff. So the fact that we were able to get rid of file cabinets and those sorts of things and are bringing all of this into the modern imaging system is really nice for a couple of reasons. We don't have to rent another facility to store the information, and then equally it's at your fingertips. So it's really important when staff go to look for information. So kudos to everyone who's working on that. And other than that, I think that's, you will have a copy of the book on your desk. I don't know if Andrea wants to talk about it, or you want me to say something about it? Okay. Well, when I was working with NCSBN, there's a lot of discussions about just culture and, being less punitive and more focused on patient safety and quality improvement, those sorts of things. And David Marks is kind of the the father of it. He's kind of the most well known for just culture. And he wrote a book called Whack-A-Mole, The Price We Pay for Expecting Perfection. And it discusses a lot of different regulatory type entities. Aviation's one that obviously has a lot of regulation is associated with it. Medical, nursing is discussed in this book. The North Carolina Board of Nursing created a complaint evaluation tool that might be worthy of review. I talked to the exec last night and she was fully supportive of, talking to us if we want to. And they do have some information on their website. It's pretty good. They actually did have David Marks come and do this training for staff. But he does, or they do, I guess it's a company, do certifications for staff, investigators, those sorts of things. It has a cost to it, of course, but as we start looking at these new ideas and some of this, I think it would behoove us to look at this. So we wanted to provide you with a copy to give you some information. We're going to give one to all the leadership staff. I think we give it to the AAGs and everybody too. So if you have any questions, I've read it. It's a really good read, and people in the audience might like it too, actually.
I deeply appreciate that coming up and that we can learn more and find improvements. I feel like with what we've had, we've done very well, but there's always room to get another perspective, and we're always open.
At our strategic plan meeting, actually, the debrief Carol and I had afterwards, we've been focusing on the actual strategic plan itself, and we're getting done phase 1, phase 2, all this stuff. But we thought, like, do we not have one the next year? Do we have one and do some sort of training? And this is when this actually all started coming up. We started talking about this like 6 months ago. But now it's fresh, so we might want to consider something like that. I think it would be good. It'd be good for staff. It'd be good for see where we go.
I do think that's worth noting that this has been part of the conversation, follow up from different strategic planning meetings. While this is something that came up as a point from the committee on Monday, that these were already in your hands, like planning to present to board, have conversations with staff and figure out how we can take this sort of information and improve some of our processes and take that into account. So just to acknowledge that.
Carol, I mean, we're very closely, so I mean, we have the weekly discussions about all this stuff. And we're always trying to think of things for the staff and everybody, and this is we actually did secure a few copies of this right after our board retreat. Was that April? So they didn't have enough for us to buy yet. It was sold out. So we were like, we'll get it at some point. And there's another one that we're gonna maybe look at too. That is with our industry, has some feedback and some suggestions. And so I think it would be a good one as well. But there's not enough of them to order right at the moment because it just got released. But we'll get it hopefully for the next meeting.
Thank you. I will just move to, does anyone have questions for Adrian? Sorry.
But thank you again for her work. Thank you to everyone that has put so much into these meetings and every day.
Okay, I will move to your right and we'll get the licensing supervisor staff report.
Thank you. So in my staff report, what you're gonna see is the total, the new licenses that we've issued since the last board meeting. So we did just over 2,500. So, and then I always include all of the renewal statistics in my report, because renewals are where our, that's the main hub of our licensing. The total count of our active nurses, lots and lots of positives. I think that was due to the May graduating class. We're still seeing the effects of that. December will probably go down a little bit, but classes are smaller. So the total number went up 1,200, so that was good. like I said, December will probably go down a little, but I think in general, we are starting to see sort of things even out from COVID and we're starting to go up. So that's good. So I did add a few things. I wanted to take a few minutes to, there's a lot of information about the Board of Nursing out there right now. There's a lot of information about our processes and what we do, and there have been in some meetings, some things that I just wanted to take a moment to clarify with you guys. So unfortunately, because of the fact that we have 74,000 nurses and there are 4 people on the licensing staff, we do rely on the nurses to communicate with us, to watch their license, to, when they submit something, if nothing has moved, if they submit a duplicate payment, if they, if something is wrong, it's kind of like that verbiage, if you see something, say something. Unfortunately, the system, the way that the system is built, some things will go through, and if we don't have anything, for it to flag, like they answer yes to something, we're not gonna see it. So we do rely on them to be in communication with us, almost the way that I've been thinking about this, and it's like when they submit an application, they rely on us to go in and process it. We rely on them to send the information to us so that we can process. One of the big things that I noticed in the first committee meeting was the RN renewal versus the APRN renewal. I just kind of wanted to highlight that for you guys because so I'm trying to think about the best way to say this. Okay, so if a person has an RN and an APRN license, in the old system before we did compact, those would be tied together. So they would be able to renew them at the same time, which was great. Because of us being compact and the fact that in some cases, if they have that multi-state license in another state and they don't need that RN license, we had to separate them. Which is a little bit harder for the ones in Kansas that still have to do both because they're gonna have to do both separately. It's easier for the ones that only have to do the one. Okay, so if you go through our system and we have corrected the error where it would allow you to submit duplicate payments. I'm not sure how that happened, but we have corrected that error. But if it were to allow you to submit, well, and generally what it would do is it would just pick up everything in your cart. So if it's in your cart, you're gonna pay for it. We have put several notices about, make sure you are paying for the correct thing, make sure you're submitting the correct thing. We don't want you to pay for something you don't need. We can't give back those fees. We have that everywhere. We are relying on them to read the information also. So if they were to go through and they were to submit, 2 renewals for the RN and not even touch anything for the APRN, in a perfect world, they would see that and they would say, and I have a lot of people who reach out to us and to me also, and say, I have gone in and I have renewed, but my APRN is not renewed. We then go into the system and say, okay, you did your RN renewal twice, but what we can do is if you would just submit a renewal form so that we have documentation as to how we're gonna renew the APRN, we can use the fee that's already in there. So again, we need communication. We're relying on communication from them to say, this is wrong. Okay, we can fix it. The issue with the APRN and why some people may get a courtesy call for the APRN renewal is because of the fact that the APRNs may not need the Kansas RN, but have a multi-state RN in another state. So sometimes they don't realize that, or they go in and they renew just their APRN and not their Kansas RN, which we cannot renew the APRN without that RN license. Those show up on a hold report for us. And so Barb is very good. She will reach out to them and say, you have submitted this renewal application, but I cannot do anything with it because you have not done anything with your RN. And I cannot find evidence that you have a multi-state license in another state, which then they say, okay, I'll go back and renew that. So I know that there was an issue of, some people get a courtesy call and some people don't. And that is true because we can only work off some of the reports that we receive. But again, we're hoping that even if they go in and they renew, you know, and they say, you know, reach out to us and say, this isn't working, or this hasn't gone through. There's nothing, unfortunately, for an RN, if they don't have any holds, any, you know, if they just went through and did that, there's nothing in the system that's gonna flag us to go back and look at it. But I will tell you, there are options on the MLO system now, for me to run an unallocated and a partially unallocated report, which is duplicate payments, payments that are stuck. I run those once a week. I work those once a week so that, you know, we make sure that we don't have those things hanging out there. We're trying to communicate with them. There's several emails that I send out that, you know, or if they say, I submitted my application and it's not there, and then I can say to them, you're right, you know, we've pushed it through, well, and I work on it right then. So we are doing some things in the background to fix that problem, but unfortunately, you know, Adrian is correct. We can only work as well as our system works. And it is very outdated. One of the other thing that we had program administrator meeting on Monday. I took the new MLO One system and I showed it to all the program administrator meetings. And I got a lot of great feedback on it. They even, you know, wanted me to add a few things that I didn't think of. So that's great. You know, because we want the system to work for them and we want it to work for us as well. So they were very pleased. And I think it's going to be great. We worked really hard on it and I think it's going to be very beneficial whenever we can get that out. I know there's been so much going on right now. But so I think we're on the right track with the new system. We have listened. I feel like we also, you know, if licensing gets complaints over a certain thing, there's something on our website they don't understand. I go to Adrian and Carol several times. You know, can I change this? Can I move this? You know, this is what I'm hearing. They're not seeing this. How can I make this more accessible? I feel like we are very accommodating to helping and to the needs of the nurses. I am not sure how much more accommodating we are supposed to be. So, I mean, I feel like we have done that ever since I have been in this role. I feel like we really listen to what they need and what they want. However, you know, we do have to have those requirements to be able to issue them that license. So do you guys have any questions for me?
I do. So I graduated in 1990 and I've worked in multiple states. Every time I've renewed my license, I go in and check because I'm human and I also didn't grow up during the computer age. How soon does it show up on Nurses, which is very accessible and doesn't cost a dime?
So actually, Nurses is typically for a renewal.
It shows up it runs once every 24 hours.
We try to tell
So
them
within
within 24 hours.
But
I
our
would know
system
whether,
is real time.
oh, ours
So,
is real time.
Yeah, if they go and search our database, it's real time.
Well, I'm coming up on renewal, so I just want to be sure, because I know I always check.
And I will clarify, I forgot to mention this, I apologize, Ray. MLO One is what you heard is, it's a bolt-on to our existing system. The board, I think it was at our strategic retreat a year ago, approved us to upgrade the external, the eGov portion of our website, to be more mobile and more modern looking. We've been working on it in conjunction with the Evoke system. It was a dual project. We got money for the new members. There was a committee called Spark, which back during the COVID days, there was some money that was issued out. Some people called it ARPA, some called it recovery funds, et cetera. Well, we were fortunate enough to get a little bit of that funding. And we use that to build the MLO One, to upgrade the infrastructure, to work on some of the Evoke investigative and discipline. It didn't cover the whole project, but it is, you know, it was a substantial portion of it, which was very helpful. So we've been going through that and reporting all of that. Ray's done a lot of work with the team at System Automation. This is not an ultimate fix. I mean, it's kind of like I said, you got your 300,000 mile car. You're putting new tires on it, you know? So it's gonna get you a little further down the road, but we need to, once we move to the Evoque, actually that system will also be retired because it will also be end of life. They're moving their entire platform to Evoque, which is much more modern. I suspect that the functionality that will be available in there might accommodate some of these APRN, RN dependencies. We are a single system, so we don't have access to every board of nursing. We do through the Nurses platform, which is hosted by NCSBN. Potentially, we could do an AP, what's called an API, which is a connection from a system to a system to do a look kind of on the back end. That's one thing that we wanted to do with eNotify and was going to be part of that. We also wanted to get what's called an NCSBN ID, which is a unique identifier for nurses. When they take the NCLEX, they get an ID. So we were wanting to do that so that we could depend less on the social security number and more on a number that's not as risky. So long story short, we're doing this add-on. It's been on the works for well over a year to do it. We're going to go hopefully tandem run the existing system because we don't want anything to happen with that. And then run the new one and find some people to test it for us and really put it through its testing and make sure it works right before we release it. Which is the ultimate goal.
I'm trying to make a comment. As a new director at a school of nursing, I just want to applaud you and the staff. I had students test in 8 different states after May graduation. And by far, Kansas was the easiest to work with. I will tell you that because I had one student test, and we'll just say in another state, and the form that they had that required our university seal to be stamped on it for the student to be able to test was not the accurate form, even though it was on their website. The student waited over 2 weeks for the board to then tell her that their form on their website was not the most recent form and that she needed to use another form that again had to be taken to our university president's office to be stamped with their seal and sent a second time, which then was 2 more weeks before she was allowed to schedule her test. Yes, so while there may be some issues that you've admitted with our system, it is by and far easier than the other 7 states that I work with this year. And I can also say that if I send in the test before transcripts by sometimes 10 o'clock in the morning, my students were getting their ATT that same day. That means somebody in your office was processing this to Pearson VUE the same day. And I can tell you in no other state were students getting to schedule their tests within 6 to 8 hours of me sending a form to you, and you were getting 2,600 plus forms in that period of time.
So,
thank you.
and I will say this until I leave this job in this position, especially in licensing, we realize that we are the barrier to get them to work. And they just want to work. We know that. We want to do everything in our power to be able to get them to work quickly, safely, efficiently. We want to do that. And I think that makes a huge difference because we realize that it would be different if we were just like, you know, this is our job and we do this every day. But we realize that they want to work, we want to get them there. And I think there is this perception that the Board of Nursing and the people at the Board of Nursing don't want to do that. And it's not true. It's not true. Now, in some cases, you know, like if they have to go to investigative or if we're waiting on something, it may take a little longer. But, you know, our goal is not to get information from schools, information from applicants and keep it. That's not our goal. Our goal is to process it and move to the next one. So.
No, I thought it was very seamless. Any issue was usually the student hadn't paid
Yes.
Pearson VUE,
Yes.
even though they were told in class to do that in April. And even when I called or emailed to ask, you know, where's the delay here, or they marked on the ULR, that they were not a resident of Kansas. I mean, it was just human error, but again, it was their mistake. It was never on the board that was the delay. So please don't see yourselves as a barrier. I found absolutely no issues at all. So
Well,
thank
I'd like to give a little credit too to Colton and Tony. They both, you know, we're the tech guys, but I very rarely see any of these tech issues bubble up to me. They are taking these calls all the time. And whenever they work, they all work very closely together. You know, we have messaging and texting, and, you know, we even have this, oh yeah, I forgot to tell you, you know, there's this emergency form, it's got all our contact information on the back. You know, they do a lot of work, and we use the analogy, in one of the hearings that basically, if you go to Chiefs Stadium and you look around at every seat in Chiefs Stadium, there's more nurses than there are seats in Chiefs Stadium. There's 72,000 seats in Chiefs Stadium. We have like 75, 4 or 5, whatever it is, nurses. And basically it's Ray's team and those guys that are, and then, you know, the rest of the staff dealing with the other part, but just the actual license applications. That's a lot of people. So if we didn't automate and we didn't have what we have today, I was here when that happened. And there was a legislative post audit, and it was to the Board of Nursing back then. And we got a couple more staff members, and we were basically the same size. We had about 41,000 people back then. And we have increased that much. It's still basically the same size staff. So that's because the board invests in technology, they invest in their staff, they invest in processes, and, you know, measure these guys up to anybody. You know, I'll stand firm by it. I've been here long enough to see it, so I know.
Also, thank you to the members of the board. You know, you guys support, you give great feedback. You know, we're constantly changing, processes, and, you know, it wouldn't be, I tell Adrian all the time, I'm like, I just want to come to work and not have to change a process and change something, you know, that's gonna affect 10 million things down the line. But you know, we do it, and, but I appreciate when I come to the board meetings and give my staff reports, you know, you guys give great feedback, you listen, questions. So, you know, that helps me be able to do my job the best. So the best that I can.
You did forget one thing. She does tell me, I just want to come to work, and I say, please continue to.
Yeah.
So, I can't manage it. I'm gonna do
Sometimes
that
when I
too.
come in, if I'm upset at something or frustrated, and I'm just like, Adrian, and he's like, please don't quit. But I'm like, but I have an issue. So, but yeah, so thank you for that. Do you guys have any other questions or?
I have one, Madam Chair. I would, so I'm gonna make this comment, and I would highly encourage, as you guys look at the processes and as you look as things were mentioned and how things can be improved, to make sure that we are bringing that back to the board of self-look, whether it be money, technology, FTEs. Let's really hone in on what examples were brought and really look at working on those. And what does that mean? And really making sure that you're bringing that back to the board, so then that way we can, you know, ask for those things or look at those things and really delve into making some substantial changes that need to be happening or done.
Thank you.
Thank you. We'll move to education.
Thank you, Madam President, members of the board. Mine will probably be a little briefer. I'm coming into a very busy season. It's not that it hasn't been busy till now, but summer's usually a little bit lighter. I just want to highlight a couple of things from the report that's in your packet. I'd like to let you know kind of the new things. So we had only one site visit this quarter. We usually don't have them in the summer, but this was an initial visit with Chamberlain University. You'll hear more about that. We did have notification of one closure of an adult gerontology primary care nurse practitioner program. Katie is closing that, just not enough for that primary care role. All of their graduates, they've all are done and through, so they don't have anybody still lingering out there. So they've officially closed that track. And all the records and transcripts stay with KU, obviously. And there was one change in program administration, during this quarter, Highland Community College. Their program director retired, Anna Fowler, and they named a new director, Dr. Patty Palmietto, and she began on July 1. There's information there about FQRs. Those are staying pretty stable, it's not increasing. That's probably been my primary goal, and obviously with school starting, that was a big deal. I am seeing a pretty steady on degree plans and higher exceptions. So, we're still seeing some of that, but not as much. We, from a high of 56% in a quarter, I think it's was down to 37% this quarter. So just a little highlight there. One thing I wanted to mention, and I did this in education as well. I do responses to NCSB and education surveys, and these are surveys that are put out there by other boards of nursing regarding some type of education. And one of the ones that I did this quarter was on out-of-state programs and clinical sites. And I bring it up because it comes up sometimes at site visits, or I get questions about why are there so many out-of-state programs, students at clinicals, our students can't get in, or, and the questions were regarding how states handle out-of-state or online programs using their state for clinical. So we do have a lot, this is mostly at the graduate level right now. We do have RN to BSN, but it doesn't affect us quite as much because there's as much clinical time in those programs. But I think one of the issues is, and what they were asking about is there any, we don't do any regulation of out-of-state programs or online. So if they have students from Kansas, as long as they meet our curriculum requirements, they can apply for licensing here. They just have to meet those when they come, but we don't do anything in the in-between. So it was just interesting that some of the states, I looked at some of the responses. They do have sometimes reporting that's required of schools that are using clinical sites in Kansas for Kansas students most of the time. But some states, it was interesting, because they have borders. They had border states that were using more clinical sites in their state than they were in their own. And they weren't the other state students. They were the hosting state. So it's just kind of a matter of, it was just an interesting thing to think about. And I don't know that we want to increase our workload, but I do know sometimes there are, especially Missouri, Kansas, I think that's where probably the biggest issue, not issue, but I hear more from that area, and I'm hearing more about other states paying facilities for students to be preceptored or use their clinical sites. So it's a facility issue, but I just sometimes wonder if there isn't if we had more understanding of what it is, if there would be a way to talk with facilities more about an awareness if our own schools are having difficulties. So just a thought, something I want to keep been keeping track of if anybody has any interest in that. I think otherwise, I don't know how much more Amy might say about the LMHT task force follow-up. Per the request of the task force, we did meet with Scott Brunner, Melinda Gall at KDADS. And the reason is because there was a request made at one point from the task force that was either looking at the possibility of basically shutting down the licensure program. And we've talked through some of this about how right now, the amount of time that goes into an LMHT license is more than our LPN programs require. It's been difficult. Osawatomie closed their program. They were the last of the state hospitals to have one. We did have, in the meantime, as we were talking about that, we had 2 schools that asked to start LMHT programs. So WSU and WSU Tech are both doing that. So they're starting to get some folks in those programs. So the question came up that the recommendation was probably going to be that the licensure be ended and a certificate program, because it seemed more at that right level. But before anything was done, they asked us to meet with Scott and see what their perspective was. Would there be a way K-dads could take that certificate program? So ultimately, we asked if he could come to talk with the committee, and he did do that. And so I think, and Amy, you may want to touch on that more later, but I think there's gonna be some more task force follow-up after the discussion with him and some of the discussion we heard about what's going on in Wichita and the possible need. So it's not done yet. I think we're kind of gonna go back and use the information he gave us and do some more work. So that was one of the things from this quarter. I think two things I want to mention. Annual report was due June 30th. We did get everybody in on time. Unfortunately, we've had a couple delays. They always do, NCSBN does a great job of cleaning up the data, making sure people are talking on the same question, that it's congruent. And we've had a couple of delays because we have a couple of schools that haven't quite finished that cleanup, and they're waiting on response. So it's been a little bit delayed getting to me. Still plan to have it at the December meeting, but I just wanted you to know that I don't have anything from that report yet. So I didn't, sometimes I can bring you some preliminary, but I do not have that in hand yet. Two other things, it was just at most of the interest. I did attend the Kansas Nursing Education Conference in July this year. And then I did get to go to NCSBN annual meeting this year. The interesting thing is that biggest topic at the education conference was AI and nursing. Great speakers, some great information about how it can be used, you know, what to look for, how to set it up so that it's a learning instead of a detriment to students, and just some really great information. And then at the annual conference, they were talking about AI and regulation. So it's just really out there, and there's a lot of good things that are happening. Some other things we're trying to work on how to avoid, you know, some of the problems with it. But I think there is good information out there about it. And I really appreciated the opportunity to get to go to those two things. I think I'll stop with that. If there's anything else in the report that you have questions about, I would be glad to answer those. Otherwise, I will leave it there. Thank you.
Thank you, Madam President, members of the board. In your packet is the practice specialist report, and again aligns with the strategic plan of the KSBN. The data, you will see the couple of charts, applications requiring legal history review, and the complaints. There is after attending Monday, there is a misunderstanding as to how cases are generated, and that not everything is a complaint, which is what I was told. Everything becomes a complaint. What they don't understand is that applications that require legal review don't always end in a case being generated, and complaints that require review for an allegation that's reported to the KSBN don't always result in a case being investigated. So there are two routes in which a case can be opened and investigated. And so I will build upon disciplinary counsel's algorithm that they presented on Monday to the legislators, and I'll bring it back to investigative committee in December, as well as to the board, so that you guys are aware of how cases are generated and what maybe put numbers on that as well, since they seem to want numbers of how many we are not opening because they don't meet jurisdiction, or there is no violation of the Nurse Practice Act that's alleged by the complaining party. You know, I've given examples to students when I tell them, you know, it's like, or to other conferences, we get complaints in the door where my neighbor's a nurse, she lets her hedge grow too high, you need to revoke her license. Well, do we have jurisdiction? She's got a license. Is growing your hedge too high something that the investigative committee and the board can take action on? Is it a violation of the Nurse Practice Act? No, we're not the right venue for that. Maybe your HOA, small claims, I don't care, but it's like, it's not administrative law. trying to get people to understand that is very difficult. I've been yelled at, screamed at, everything. Via phone and email, it's very difficult to handle some of those people, but they need to understand that there's a difference between administrative law, civil and criminal, and we're just administrative. So I just will build upon that algorithm and bring that back so that the board is aware and the investigative committee, but it's very troubling that it's just misunderstood. So our complaints and our applications, we still review. The significant investigations, I am seeing a decreasing trend in the reporting of significant investigations. And then I broke down, because what they asked on Monday too was the breakdown of data. So I did break down the data for just a very rough view, because everything is collected in calendar year and we have to report in fiscal year. So I have to actually have time to really look at data where I don't get confused on numbers and be able to spend my day without interruption, which is never a day that I have. But it's like about 15% of the complaints that we have come from risk management. And that's over the calendar year 23 and calendar year 24. About 15% reports are from healthcare facilities administration. So I included HR supervisors, DONs and vice presidents, administrators, those type of people that are not a risk manager. 8% are coming from coworkers or other healthcare professionals, like a physician, another coworker that is reporting some sort of issue. And 6% from those 2 calendar years are coming from patients and patients' families. So that's the breakdown. I will continue to add that to the metric. Carol and I have been talking about the performance-based metric because they've always been this. Just because it's always been done this way doesn't mean that's always how you continue it. So what do we need to see? And I find that there's a lot of misunderstanding as to what we think this metric means and what is being perceived. So I'm going to drill down into all of that and make sure that if you want this data, I'll dig for it, but it's going to take me time to dig for it. So yeah, we'll be looking at that. The complaints, what I will also do is this trending down of the significant investigation. That kind of troubles me because I know nurses are hurting on the floors, and I know that there's increase in, Dr. Ruth and I talked, increase in substance use disorders. Mental health is a huge issue. I don't want to lose a nurse to nurse suicide. So how do we get that information out to the people who need to be aware? Complaints referred for abuse, neglect, and exploitation. I continue to send them to KDHE, KDEDS, and KDOC, DCF, APS. I found everybody's contact information and how to report, and it's like everybody has a whole different way to report. And so I continue to do that. I'm starting to get a response back from some agencies giving me a reference number, or I've even gotten like a recent one that said they found that their investigation was unsubstantiated. So it's like, fine, but you have the expertise to investigate. So you go investigate. And if there is something that this nurse did do, then please let us know. The complaint evaluation tool that you mentioned from North Carolina, I did review that, and it is in my toolbox, but I need time to be able to really kind of drill down and look at how we can implement that, especially moving to finally an electronic submission of complaints. Been wanting for 6 years, so I'm thrilled. But I can look at that again and bring it back in December as far as what that looks like and what changes we could potentially make. Carol and I can visit about that as well. The licensees are also referred to KNAP from a complaint allegation. So sometimes the complainant alleges so many things, and there's like the risk manager, they may have performed a for-cause UDS at work that's positive. They may include the lab result. They may, have video evidence. They may have whatever. If there's a significant, for me to believe that they need some help, I don't want to wait for the case to get investigated, to get to discipline, to then go through the judicial process. That's 2-3 years, and addiction can take hold fast, and we need to get help fast. So for somebody who's coming to our attention from the complaint, it is nothing to just make a referral to say, it's a referral, please get some help. Because the eventual, is that they might have to have the board order to go get the evaluation. I did talk with KNAP, because I did give a report to investigative committee, and they do have, some things that they're working on. They understand that the urine drug screens are an issue for specimen collection. And so they have been working since May on finding out how to do them differently. And what they have found is that Affinity, who is their provider for the urine drug screens, is able to do an oral swab. So it's $90, but you get 2 swabs with that. So if the licensee wants to challenge the result on the screen, then the second swab will go to the medical review officer and they will do the confirmation and go from there. But the beautiful thing about this is that they will have the first urine drug screen. So they have to go and drive to a site. And the problem was that some of these sites are charging a specimen collection fee, which is what we're like going, why? That's just more money. So they're doing that on top of the urine drug screen cost. So the oral swab, they'll have the urine drug screen done first, and then they can request from KNAP up to 5 times to do the swabs. So they will send them 5 kits, and then they will do a kit virtual with Affinity, and they will then use AI for the next times that they're called for a random drug screen. And that's working, and licensees are loving it. They're not having to drive, they're not having to leave their place of business. They're able to get this done. It's working out very well. There are times that they have to have approval from KNAP to be able to use the swab at that time of random drug screen. So there may be times when the KNAP says, no, we need to have to produce a urine today, or a hair, or whatever they want to produce. So that is still up to KNAP. KNAP is also doing surveys of participants who are currently in the program, who have successfully completed the program, and who have not successfully completed the program, so that they can see what are the issues that are currently plaguing the current participants, so that they can continue to make changes. So I applaud them in their efforts to be able to kind of like address some of these things, but nurses are hurting, like I said. So cases, we continue to work them as fast as we can. Complaints keep coming in. Discipline, we have now 2 part-time assistant attorney generals in the role as disciplinary counsel. So our numbers are going up as far as, being able to get some discipline assigned as a reflection, of that. For Cora, for open records, I'm slowly transitioning this to Andy. And I'm excited because he's doing very well, and I'm gonna get some help. Yay. But the time frame, we continue to see an increase in requests coming in. And then the processing times, and then we also continue to do the mailing list. I did go back and look with Andy's help, a trend over the last few years, which indicates our average days to produce. So for fiscal year 25, we were averaging between 7 and 15 days to produce after we received the request. For fiscal year 24, we were averaging 8 to 19 days to produce. And for fiscal year 23, we were averaging 3 to 8 days. So I feel like having Andy is going to help us even for fiscal year 26 to continue to be getting it down to where it's about 7 to 10 days. The AG's office also finally gave us a written reference that we needed to start after we send the 3-day letter that's drafted by the general counsel, that at 10 days, we need to give a status update if we're not producing the documents. So we've been incorporated that into the current ArcCase software that's been creating as well. So Andy's been instrumental in helping that process go forward too, so that we can give that information as well as being able to produce through this way. And people are using the ArcCase portal to be able to access and request open records, which is very nice. So since the last board meeting, like I said, ArcCase, and then we've also had weekly discussions with the Evoke case management software system, which is very nice. And we're in the testing phase where the investigators are thrilled because I created some test cases about all different kind of varieties that we get in, and they have like told me they're trying to break it, and I said good, because this is where you can. So don't break it when it's finally in production, but now is the test phase. So try and do whatever you need to do. We have found some glitches, but we're working with Colton, who's being trained on the back end. So he were able to share screens, and he's able to kind of get some stuff changed for us immediately. So it's been very, very good. So nursing practice related inquiries via phone and emails. We presented this to the practice committee yesterday. we're gonna look at a variety of options because we're getting a lot of complex inquiries and how do we handle all of these? And, you know, we're not allowed to give anything out except a specific statement that we're not licensed attorneys. We can't give legal advice. We can refer them back to the Nurse Practice Act. And then I get yelled at again for that. So it's just not working. So we need a different way to be able to communicate when people have inquiries. What do we need to be able to address? How can we address, if I know of a resource, like if it's an infusion nurse question, I will tell them to go check your infusion nursing society. If you're not a member of that, please, look into that because that's your area of specialty. So they will be up to date on evidence-based practice that you can apply and advocate for your facility to be able to maybe adopt some of those changes. I don't know what you need, but we know that you need to be educated and trained and show these things, if there is a complaint that's received. So yeah, that's all I can do. I just can't do anything more. So the committee, basically, practice committee is going to also, we had some student nurse or some school nurse questions that came in. We had some questions about operating a business, and Charles is helping to review some of those. But the committee decided to, I think, look at the delegation of tasks for the school nurse in the school setting. And we're gonna, because it was last updated, I think in March of 2023. So we're gonna kind of like look at that again to kind of see if we can't bring that back up and see if there's changes that need to be, or additions that need to be added. Let's see, I talked about and then I attended the school nurse conference as an exhibitor this time. And I was just down there for a day and a half and it was very enlightening. I was amazed at the number of school nurses who stopped by our little area and we talked about Nurses E-Notify. We talked about, mental health for them because sometimes they're dealing with very difficult situations with the children and the families and being told they have to do whatever from their administrators and they're just like, I don't know what to do. And so we talked about mental health for the school nurse. But I also had a card for them that said, please put on here and said anonymously, remember your reason why. Why did you choose school nursing and why do you stay? Because all I read is that nurses are leaving the profession. They're retiring, or I read an article, that was published last year in the online journal Nursing that said that 33% of newly licensed nurses are leaving the profession within the first 1 to 2 years, not because of the Board of Nursing, which was what was reported, but because of the workplace environment. So, and then it's like, why can't our environments be more conducive to, keeping our young? I mean, they're our future. They're the ones who are going to be teaching us and training us, and we need them to take care of us and know what they're doing. So I was very alarmed by that. So I like going and listening to why you're still in nursing. And I was very encouraged because a lot of them said, yeah, sir, summer vacations was what enticed me first, but I stay for the kids. I stay because I get to advocate for the children. I get to advocate for these families. And to me, that was just, thank you. Because I needed that piece. So I was very encouraged by that. I will say too that we met with the statute review work group, but the investigative division did do a study kind of tying in with what Rayanne was talking about with the phone calls and everything. We did a study in 2020 when I first joined the investigative division and to see how the communication could be better between licensees and applicants, because at that time we were doing we send a letter via snail mail, we wait 30 days, we send the second letter via snail mail, we wait 30 days, we send the third letter via snail mail, and we got no response. And so it was like, okay, what else can we do? So we changed and we did a study where it showed we sent the letter, no response. We made a phone call, not within 30 days. We didn't wait the full 30 days. We made a phone call and we sent an email via generic information because of the hacking that's available for people who want your email, just letting you know. So what we found was that the letter, still no response. The response to the phone call, the state's phone system needs updated. It shows up as spam and 000 for people and they don't answer the phone. And I got this just from my practitioner just the other day when she said she's trying to call people and they don't answer the phone because of it. So I was like, okay, well, it's still happening. And their voicemail boxes are full or not set up, and then we don't get a response back. If we sent an email, and if they had updated it from their student's email, which goes inactive after a period of time, from their educational institution, then we would get a response back and we would say, please check your mail. You know, we have a letter from the Board of Nursing. And they would be like, oh, my mail goes to my mom's house. Okay, that's our means to be able to communicate with you. You know, we only can do so much. And if you want us to call 35,000 for a renewal, when only 100 are having a problem renewing, that's 0.28% of the nursing population. 99.72% are not having a problem. That is not statistically significant to change process. I'm sorry, but I'm a quality person. That data does not help me at all, but I will do whatever anybody wants me to do. But then you need to give me a state's phone system that actually works. Just yesterday, I talked to a gentleman. This is another issue that comes up. He wanted me to tell him how to answer his questions on his application. I cannot do that. That is a legally binding document. He has to attest to those answers. I cannot advise him. I'm not an attorney. So I talked with him for 35 minutes and he thanked me at the end for explaining the process because I said, answer to the best of your knowledge. If something were to flag, it will come to us. We want to have a conversation. Why did you answer the way you did? What are we seeing? What's the difference? You have a conversation, hopefully via phone call. I don't know. So, but I don't have 35 minutes to speak to every licensee and applicant who needs me. I don't have that time of day to do that every day. So I just wanted to let the committee know. And apparently I included my June notes from the board meeting and attachments, you know, from pages 4 on. If that's my only error that I managed to create in these last few months, then I'm so sorry, but I'm sure there's others. So I apologize. I'm just very emotional at the moment. Have any other questions?
I would like to bring one thing to the forefront. Your investigators aren't making decisions. They're gathering information. Not sure if I'm supposed to say this. LPNs are information gatherers. We present the facts to our providers, to our RNs when indicated. We don't make, oh, did you know they got this? No, we don't do that. We gather information. An LPN on the investigation committee or on the investigators is a step forward for LPNs. And as y'all know, I highly support that. They're the backbone and they're very observant and they are the eyes and ears, but they do not make the diagnosis. And we do have an LPN investigator reading her reports. She's very thorough. She's very much in line with our RN investigators. So I did want to put that forward, that was a big step forward for LPNs. And the schools that teach our LPNs and the facilities that continue the education. So I did want to put that forward, that I deeply appreciate all of their hard work. And if an investigator feels they need more information or they're not, because we've had a couple of cases with nurse midwives and such that was very in-depth. They would reach out and ask for help.
And there was a misunderstanding that we do have an LPN investigator and she is assigned cases that relate to an LPN that is being complained about. She does a very good job. She is on the list to go to the next basic nurse investigator training, and NCSBN had changed their process. So I was twice a year. She's been on the wait list now, and I'm on with Tim. Don't worry. Yeah, I've got 3 that I need to get into the basic training. Sarah just joined us in August, September, so she can wait maybe 6 months, but I need to get 2 in there. So, because the next step is the clear special investigator pieces, that's the tier 2. And it kind of goes more into a more in-depth analysis of how to do your interviews, things of that nature. And then there's Clear has also developed a tier 3. So I have two investigators and myself are all the way through tier 1 and tier 2. I have one investigator who has gone to tier 3 and has taken the investigation into sexual misconduct cases. And so she gets all of those, unfortunately, but she's had that training. So she gets those. I also assign complaint cases to the investigator via several ways. One, if they have the expertise, then they're gonna get that type of case. If I have a psychiatric nurse previously, so she's gonna get those who have mental health, substance use, things of that nature, because she's gonna understand and how to tie those things together. I have a nurse who's got a pediatric background, so she gets those, and we give her boxes of tissues because she cries a lot when she's reading some of those cases. But she's trying to deal and dig for the facts of what happened, not just what you did, but what happened in the system? What was going on that day? Were you charge nurse training and taking care of a patient? I mean, that all has to be known. And so they're digging for the facts so that the board makes a very structured determination as to where was the issue? Where was the error? And what all needs to happen? So and then I also assign nurse investigators by facility. So if you have no other means to be able to kind of like have something assigned to you, you may get all of ABC Hospital's complaint cases so that you can develop a relationship with that risk manager and the HR directors, and you can continue to kind of have that rapport going. So that's been going on for some time, and we have been doing the nurse trainings. So that was mentioned that we weren't doing any, and it's like, no, I know we are, because our nursing staff is pilfered by other state agencies because we are the ones training them. And to me, that's very disrespectful and unprofessional of other state agencies. They're not investing training. We are. And then they're being pulled for another $1 to an hour more and given full-time remote. And it's like, well, I can't compete with that, so I apologize. I'm just very emotional with those. I'm very.
I'll make another comment. I would also bring this forward as we think about delving in and really leaning into what was brought to the attention in these committee meetings and really stating what is needed. $1 more in remote, I think that is something that we should look forward to. And how can we manage that and ensure that we keep the staff that we're training, and regardless what avenue that is, and what we need to make sure we are providing safety for the public. Thank you.
Do we want a motion for that?
That's my recommendation.
It is part of the strategic plan.
So I was just talking.
And if I might make one comment I forgot to address, but I do want to thank Linda and the investigative committee. When we started the EVO project, it was very specific for a certain thing. But Linda came up via the investigative committee to have a board portal to make things easier for that committee, and I don't see that because I'm not in there, so I don't, but they worked really hard on it, and they still really are, and thank you, Colton, too, and system automation, because they didn't charge us anything extra to do that. So it's hopefully gonna be something nice, and it was something that she really spearheaded, so I appreciate that. It's gonna be nice, I hope.
I think I came in some recommendations from some of the committee members, because
They
it'll
both-
help
Yeah.
speed up the process of the review,
It'll be more secure,
more
more
secure.
accessible,
Yeah.
the whole bit. So it's really, really nice. It's a great idea.
Any other questions? Sorry.
I might just add, I think as to Melissa's point in some ways, that you heard it from licensing, which for you, I do think it's very important to continue to track your processes and those process improvement items that are already taking place and have occurred. And you can provide the information that if folks want to choose to review that and see what's happening, they will. They may not, but we can show those efforts that are being made. I also think to show what can, it's always hard to look at systems and not, people are personally invested, which I think is what make you good for your positions that you're in, but sometimes it's hard to step aside and see, are there changes that can be made? Are there improvements that can happen, and make steps to do those? And then acknowledge those, but I think also then to show, you know, if we need to have 3 staff that sit at a phone and call people 20 times around their license renewal, there's a price tag associated with
Right.
that, for that effort to occur.
Right.
And I don't know that nurses require that kind of handholding, but, if that's a recommendation, so what does it take to make those 20 phone calls, to happen? So I think, you know, just to also acknowledge for some of these things that there are, price tags associated to it, and it's not reasonable to think that the expectation is that's gonna happen for the staff that are here. You know, what do those recommendations entail, and what's the cost of that? Other. Thank you to staff for all of those reports. Are we okay to continue on to committee reports? So we will get started with the education committee.
Thank you. We had our meeting yesterday morning. A few things that we wanted to discuss. One thing that we asked Janelle to do for the education committee is to provide us with a complaint log. This isn't something that we had routinely asked for, and if you go into the education committee report per packet, it is on pages 16 and 17. She went backwards for us to 2024 and provided information for us. It is not specific to the student or the parent or the public member, but it just gives you some general information for us to have, which you can look at. We mainly asked for this because of one program that we were looking at specifically that has been on a conditional improvement plan. And we wanted to see, because she made us aware that there were a significant more number of complaints for that school versus others. So I'll let you review that. Those have also been sent to the school. So those, it's not like Janelle's getting them and the schools are not aware of them. So that was helpful for us yesterday in our decisions. One other thing we looked at that I'm not bringing forward a motion for is the English proficiency. And I believe you maybe received a request for us to consider. Currently, we have 3 that are approved by the Board of Nursing: TOEFL, IELTS, and OET. If you're getting requests that we consider other ones, if those could be forwarded to Janelle so that we can look at those and consider whether we would accept that or not. If it's a reason why a nurse isn't able to get licensed in Kansas, we would definitely want to know about that. If they're requiring, or if they've already taken a different test that is not one of those 3 English proficiencies, and we could look at it. You know, there's probably 20 out, or 12 to 20. I mean, at some point, we can't accept every single one of those. I feel like these 3 are probably the ones used the most in education and other stuff or other parts of nursing. But if you do get requests, please send those on and we will take them under consideration. One thing that was announced a little at our administrator training on Monday, and I've already been hearing it from students, is NCSBN has put out that there will be virtual ability to take your NCLEX starting in spring of 26. So students are already asking about that. Obviously, it raises some red flags. I'm sure NCSBN has security features or will have security features in place, but they're already asking us how that's going to work. So yes, Janelle.
Just a quick comment on that. That's another thing that I didn't get in there, but I have also made a request to NCSBN just for some further information or where to go for it so that I can bring that back to the committee. I forgot to mention that the program administrator update, and I apologize to all the program administrators because we had great attendance, but that was a question and a concern. And, you know, we know NCSBN has been really solid on everything they've done, but this is huge. So I'm gonna try to get as much information as I can, bring that back, and if there's more that can be done, we'll bring that back to you and see if there's anything more that you would like to have in terms of information before that happens.
They put it out on social media, then other people have shared it on social media. And I am not finding a lot of information on their website yet, so I'm sure it's coming, but just, so if you hear that, it is out there, but I don't believe anyone at the board knows how we're going to be implementing that.
I think the
Perhaps
NCLEX
let's be clear
conference.
that
is
our
a key
intent
thing.
will not be to put in barriers. that-
Right.
Oh, well,
No, we want to understand it, but I think the NCLEX conference is actually happening today. Which is, I usually attend, but with board meetings today, but so there may be more information that comes out after that because I'm sure they will talk about it.
Yes, so we added that as a request for our December meeting. And before I get into my motions, because as usual, education brings a few motions forward. We also asked Janelle, who, if you look at her schedule for the fall, is pretty much every week she has a site visit. And that means members of the education committee go with her. But based on the recommendations that were put in place in March for Donley College, we have asked her to do an on-site evaluation. And 2 board members are going to be going with her on October 13th, 14th, and 15th to bring back recommendations to the December meeting because they would like to start admissions again in January. So we've made no promises other than we will do a site visit and we'll bring it back to the table when we meet in December. Any questions? Those were the highlights of our meeting yesterday. I will go into motion. Okay, it was moved to approve the consent item agenda, which includes nursing education staff report, community log education, 2025 and 2026 site visit schedules, petition to test, retest, summary from 5/13/2025 through 8/12/2025.
We have a motion, or a second,
Patrick Goldsmith, I made the motion.
moved and seconded, any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
It was moved to accept the initial site visit report for Chamberlain University BSM program with initial approval to admit up to 120 students annually with 3 start times, September, January, and May, and a follow-up site visit to be done after the first graduation and before requesting additional students.
I'll second. Melissa Pesa, board member.
We have a motion and a second, any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions?
It was moved to accept the major curriculum change request from Rasmussen University BSM program to align with the CCNE standards and update the student learning outcomes to align with the 10 domains of nursing as part of the new 2021 AACM essentials.
Motion and a second, any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion passes.
It was moved to accept the major curriculum change from Rasmussen University BSM program to increase the number of admitted students from 10 to 20 students per quarter at the Overland Park campus while maintaining an enrollment of 10 students per quarter at the Topeka campus starting January 2026.
Motion, is there a second? Michelle Terry, second. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Motion passes.
It was moved to accept the major curriculum change request from Fort Hays University BSM program to change to the BSM program outcomes incorporating the 2021 AACM essentials, domains, and concepts with changes to course titles, course descriptions, and course outcomes within the BSM program as needed to incorporate the 2021 AACM essentials, domains, and concepts.
Motion, is there a second? Michelle Terry, second. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
It was moved to accept the major curriculum change request from Fort Hays University DNP program change to incorporate the 2021 AACM essentials, domains, and concepts with changes to course titles, course descriptions, and course outcomes within the DNP program as needed to incorporate the 2021 AACM essentials, domains, and concepts.
Motion, is there a second?
Second.
Discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Motion carries. Any abstentions? Sorry. Motion carries.
It was moved to accept the major curriculum change request from Ottawa University to divide pharmacology into 2 courses, Introduction to Pharmacology Term 2, 2 credit hours, Pharmacology Term 3, 3 credit hours, and to decrease capstone from 6 to 4 hours with no change in overall didactic hours remaining at 60.
Motion, is there a second? I'll take a second. Any discussion? All those in favor say yes. Yes. Anyone opposed, no. Any abstentions?
Yes.
Motion carries.
It was moved to approve the major curriculum change from Highland Community College LPN program to reduce NUR 126 Foundations Clinical from 2 credit hours to 1 credit hour. Add 1 credit hour to NUR 103 PN Success, making it a 2 credit hour class. Add 1 credit hour Concept Synthesis course to the LPN program that would begin in the spring of 2026.
Motion, is there a second?
Second, Melissa Scarpesa.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions?
The last one's a little long, so bear with me as I read. It was moved to approve the major curriculum change request from Highland Community College LPN to RN Bridge program to increase RN seats by 15 and add a fall admission to the program to begin in fall of 2026. Increase LPN to RN curriculum by 3 hours by reducing NUR 235 mental health from 3 to 2 credit hours and create a separate 1 credit hour course for mental health clinical. Reduce NUR 230 advanced medical surgical from 6 to 4 credit hours and create a separate 2 credit hour clinical course. Reduce NUR 225 advanced assessment from 4 to 3 credit hours. Increase NUR transitions class from 1 to 2 credit hours. Reduce NUR 250 practicum clinical from 4 to 3 credit hours. And add a 3 credit hour advanced pharmacology course and a 1 credit hour concept synthesis course.
Motion, is there a second? Thank you. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion passes.
Chair, that is all for today.
It's always a busy committee. I'll move to Edward Goldsmith for the investigative committee.
Well, we had a great meeting and, Dr. Ruth Burkhart is now on the investigation committee with us, which brings, a lot of, aspects of the mental health concerns. And of course, we have Brenda Sharp who brings the, solid common sense part to it. She will go over a work group that has been started that we're pretty excited about.
So I might just also take a point of privilege if I could, Madam Chair, and say, this has been a very stressful time for the licensees that have been involved in coming before the legislature and to the board with complaints. It's been a very stressful time for our board and our staff, and I just want to acknowledge that. I downloaded the Calm app for myself. To use that. I also bought a hat a couple weeks ago that says salty on it. That pretty much wraps up all of my position the last few weeks. But emotions are very high. This is very personal to everybody involved. And I think that's one thing we need to remember. These are human processes. These are human beings. We're all here because we support the nursing profession, every one of us. There is no other good reason to be here if you don't support the nursing profession, because that's why we all say yes, and that includes board and staff alike. The legislative hearings did raise a lot of issues for us to address. I don't personally think it's a very productive way to get to solutions, and we saw a little bit of that towards the end of the hearing on Monday. But we are committed to developing and addressing real solutions. The investigative committee and our investigative staff and our disciplinary council, I can assure you without a doubt, in my body, that we act in good faith with the information and the facts and circumstances that we have before us. We were not in a position to always share another side of the story from those cases presented, but it also doesn't mean we can't learn from those and make some changes to try to prevent that from happening in the future. But any implication that we do not act in good faith every day, I take very strong issue with. I spend personally, as does Adri, as does Dr. Burkhart, 8 to 16 hours reviewing each and every case. Most of the time, our disciplinary file is about 500 pages long. We do not want to spend our time on clerical and administrative cases. We have plenty of other major cases that need to be reviewed and need our time, and that's true for staff as well. So we do need more tools in our toolbox. We have been asking that, discussing that for a little over a year.
I think it's been 2 years. It's been a while.
And we have formed a statute review work group to look at the statutes and regs around the definition of many things, including unprofessional conduct. We all believe that is too big of a bucket. We don't like it either, but that's what we have in our regs, and we will make attempts to change that. We are also looking at lots of other states and lots of other boards, not just nursing boards, but other professional licensing boards, to see what we can learn from them. In particular, one of the major issues that's been raised with us is to develop some kind of a grace period. And I can tell you that from people in this room and people I've talked to and people I see at other events have told me a 2-week grace period is appropriate or a 1-year grace period is appropriate for renewals. That is not an acceptable variance, I think, and nobody believes that. And even the committee on Monday night was grappling with 3 months, 6 months, a couple of weeks. So we have a lot of work to do there to arrive at some consensus about what makes sense and then the implications of those
And
changes.
how employers will feel about that.
Yeah,
Because they need you to be licensed.
yes, the facilities and the hospital association, I don't know how much attention they paid to it, but they presented their information on what it means for them to have an unlicensed professional practicing in terms of CMS and payment and billing and those kinds of things. So that's all hanging out there.
If I could also say with APRNs, the DEA,
Yes.
you're out of DEA compliance if you let your license lapse.
Even with the grace period, correct?
My understanding, you cannot,
Exactly.
this is diagnostic and prescriptive authority, and there's higher regulations, well, I shouldn't say higher, but coexisting regulations on the federal level.
And I'll let you finish, but I wanted to ask Dr. Burkhart as a prescriber a question. Yes, please.
We're also looking at diversion programs and what those might look like. I was really intrigued by a report from staff that had been to a conference recently that has talked about, and I never get my acronyms right, NCSBN, talking about best practices and how we can even change our language that we use from something less punitive to something that, away from words like discipline and more towards board action. And those are culture changes that we can make. And I think those are important, and we need to use more asset framing language when we're talking about this profession, because this profession is under attack all the time. And we need to be very mindful of that, and we are trying to support those majority nurses that will never ever come before the board. So all that to say, this the statute review working group, we have in our Inviting Nurse Professional Association, some of the lawyers who actually represent licensees to share with us their experience. We're looking at NCBSN and other national groups to identify best practices. We may have some legislators that are on that committee and others to develop recommendations to review statutes and regs. That said, I think it's important for this group to know, and anybody in the public that is watching, this could be done for us as well. So although that committee on Monday could not take any particular action, they can make recommendations, and they did. And other legislators can introduce bills in the upcoming session that address any and all of these things. Now, whether or not they'll pass, is one thing. As one legislator that we talked to that's on the committee, we met with many committee members in between to try to explain some of these processes. One said, you know, a bill is an idea. And the problem with bills going through a legislature is lots of people have lots of ideas about that. And so the nursing profession, especially those that are concerned about issues around supervision and scope of practice and other things, need to understand all kinds of things can get added into some of those bills if it's determined to be germane to that issue. So we're hopeful that the legislators that may be introducing particular statutory changes or regulatory changes will engage this board, but it's incumbent upon all of us as board members and our staff and our executive administrator to develop and maintain really positive working relationships in the legislature with nurse professional associations. We have taken a reputational hit, there's no doubt about that, and we need to be mindful of that and doing everything that we can to correct that and move forward. And so I just kind of wanted to share that context and the work that is being done. And if board members have any questions about that, happy to take those.
Good question. I have a quick question. What's the timeline?
We were looking before at about a year process because we know there's really no realistic way we can get through all of these before December to have a bill introduced in January before this session. But we're hoping to have communication as they're moving forward. It looks like maybe the health committees may be a vehicle that they're considering for introducing something. We were more focused on some of the things that would allow us these additional tools around disciplinary action that would be less punitive for administrative kinds of things. That was our focus. There's lots out there. And then we also have statutes and regs that we have to look at in 26 related to all kinds of other things, fees and whatnot. That's just part of our normal review process as a board. So I don't know how those are all going to intersect, but we've been spending a lot of time on other things, and we would like to get back to the meat of that, and I'm hoping that that will happen.
So my question, as nurse practitioners, and that's Ruth, especially in the mental health field, when you're unable, vacation, illness, whatever, to follow up with your patients, is it your practice to advocate that to some other provider so that patients don't have a misstep in their medication or any of their other needs?
Well, I do want to clarify that I am advanced practice, but I did not choose to do the prescriptive authority.
Okay.
So I'm a therapist. So Dr. Orpeza does have prescriptive authority. Of course, I have a client load, but it's different because I don't
You do the
manage the
therapy.
medications, correct?
So
Okay, so where I work and how my practice is there is someone who, which I've never gone for longer than a week or so, thankfully. Haven't had an extended period of time or where I've been off, but it's a large practice.
there's a
So
plan.
there's a plan in place and
And if
those
you were
delegated.
individual, single entity, would
I-
you not have someone on call or someone that even referring back to their primary cares?
I guess that is an option. I guess that would have to be something that if you are a single entity would have to look at and making sure, worst case scenario. If you were unable to work for a period of time, nurses are worst case scenario people. So if something awful happened, what would happen? What's my backup plan? What's the other option? How does that look? But it would be on the individual, I guess, if they are an individual provider to look at that and have that readily available. is the way I would approach that without knowing any
If you
specifics.
work, on your own, would that be something that would be a priority for you?
Oh, something working, oh, if you're asking me, I would always look at worst case scenarios and kind of what would happen.
Because your patients come first.
Absolutely.
Sorry, I'm not trying to. put
No,
words
I mean,
in
yeah,
your-
no,
I
patients
just-
come first, business comes first. I mean, there's always different levels of looking at things. I don't know that I would ever feel very comfortable working alone. I'd like to have other providers around me to have that.
But we do have
Absolutely.
them.
Yeah.
And they do have that privilege that we're grateful for. But, like I said, where I work, they do have mental health providers. If there's a reason that the mental health provider cannot fulfill that prescription, then the primary care is notified so that there is no interruption. So facilities have it. I think it's something important that if you're on your own, you need to back up, just like we did with our kids.
Can I also say too, we had an inquiry from a facility this week that they requested information about a licensee to state that the licensee had never held a lapsed license because they needed that information for joint commission.
Oh.
So, which then, okay, so we start getting these inquiries, you know, you put a grace period into play, which I'm not saying is a bad thing, but those inquiries are gonna go up. It's gonna be a quora. There's gonna be a lot of questions because like Ruth stated, you know, you've got the DEA, you've got all of those outside organizations that this is gonna affect, so.
And unless there was any other questions for the investigation committee, that was it. Thank you so much.
I just have one thing to add about the KNAP. I forgot there was one other thing that that Stephanie B. Craft updated us on. She has looked at other states, since we went to that NOAP conference, the National Organization of Alternative Programs in May. I introduced her to Arizona, and so she has pulled their risk assessment for substance use, and so she's drafting like a chart that will tailor the program's requirements based on, is it a substance use chemical dependency? Is it a substance use chemical dependency with mental health? Or is there is there chemical dependency where you have an option to have a key restriction because you have access to narcotics versus if you don't have access to narcotics? So I know that that's always a question I'm in an administrative role. So why do I have to have a key restriction that's required? So it could be where that she's looking to see, does she tailor the program to that individual case? So she's looking at the Arizona model to do that. And I know she's going to develop that chart and I'll bring it to the committee.
And that was something else that we discussed. We do get feedback from KNAP for where the nurse has sent those surveys. We are interested in getting them directly back. In one of the cases, there was a question about whether nothing was found, but they had to be seen for a year. We would love to know why. We weren't given that information. Otherwise, we would have been asking why a lot sooner. So knowing what your experience is as a nurse going through KNAP will only improve it as a benefit for our nurses, which our goal is to have safe practice for our patients, our citizens. And we also want it to be something there to keep our nurses in the workforce. And when it comes to renewals or, lapsed and that kind of thing, we meet more frequently and we try to address that as quickly as possible because it is important for their income and for their jobs and the peace of mind, which one of the things that hasn't been addressed it's a soapbox. The abuse that nurses suffer under from patients, from sometimes providers, family. And it's just become an acceptable thing. And I know they dropped the ball on that, but I wish they would pick that ball up. Because you're losing nurses because they are being abused. We're getting more problems with it because of the depression, because of the abuse. When you're not happy in your job, that's one thing you love, it's gonna increase the decrease in nurses.
And Madam Chair, if I could just add, I was on the investigative committee a while back, and then now I'm back on. And I do not think a lot of people understand what the role of that committee is. And of course, it's very confidential. We protect people. Of course, we would want our information protected. But really, it is to meet with lawyers, with Linda, and to get some guidance regarding options that we have at hand that would be the most helpful. There again, protect the public, but also with a redemptive view for the nurse. We do not ever, in all my time on the investigative committee and now back again, have I ever seen an effort to be unduly punitive or to say it's over for you because this happened. So I do want to put that out there. I also want to clarify, I am not an advanced practice registered nurse. I practice at an advanced level, but I just want to be very clear that my clinical specialty is medical psych. So I'm a therapist. Sorry for that. Thank you.
I do just want to thank Brenda for being present and speaking on behalf of the board committee meetings. I do want to thank the investigative committee. Just for new board members, you know, we do delegate a difficult role to the investigative committee, and I know that they take all of the information that they're presented with into account to make the best decisions possible when they're looking at those cases, whether it be unlicensed practice or, you know, drug diversion, lots of cases that you all review. So I just want to thank the investigative committee for the work that they do. Next is the CNE IV therapy. So I will turn this over to.
Would like to give us your report.
We had an efficient meeting yesterday with some updates about an IV therapy task force that has started. Some good work done there for LPNs and IV therapy testing review. So more to come on that, which I think will be very helpful moving forward. And then we have just a few motions as a result of the meeting. It was moved to approve the consent item agenda, which includes IOA statistical report, single providers approved from May of 25 to August of 25, and provider relinquishments.
We have a motion. Do we have a second?
Second, Melissa Warpesa.
Thank you. Any discussion? All in favor signify by saying yes.
Yes.
Opposed, no. Abstentions? Motion carries.
It was moved to approve the long-term provider 5-year renewal application from the Education Group LLC, LT 0258-0310, with recommendation to ensure teaching with updated references.
Have a motion. Do we have a second? Second from Carter. Any discussion? All in favor signify by saying yes.
Yes.
Opposed, no. Any abstentions? Motion carries.
It was moved to approve the long-term provider 5-year renewal application from Olathe Public School District Health Services, LT 0242-0950.
Have a motion. Do we have a second? Salisbury, second. Thank you. Any discussion? All in favor signify by saying yes.
Yes.
Opposed, no. Abstentions. Motion carries.
And our final is moved to approve the initial long-term provider application from Nurse 20 LLC with recommendation to include APRNA statement if applicable and to update the bibliography to clarify age of resources.
Do we have a second? Thank you. Any discussion? All in favor signify by saying yes.
Yes.
Opposed, no. Abstention? Motion. Thank you. Meeting closed.
Okay. Thank you. I will.
Thank you, Madam President. We had a very quick and straightforward meeting yesterday. We don't have any motions. We are still waiting on 2 regulations that are for the CNM independent that needs to still be approved, and we've reached out for, or Carol's reached out for that, so hopefully that'll come forth hopefully in December. The updated revision of the KAR 60-9-106 is still an ongoing process, so we'll have that updated again and see where that stands in December. And then we are also doing the combining of the state and regulation review process, and we'll be starting that also, looking at seeing how we're going to implement that going forward as of December. And that's pretty much concluded our business yesterday.
Next. To Michelle.
Thank you. We had a very productive practice committee meeting yesterday. We said goodbye and thank you to 2 members, Amy Wren and Greg Morris. They had their last meeting. And then Linda provided her practice call report, 3 main buckets there. The first one being needing a better system to receive and respond to inquiries. So we had some great ideas as it relates to chatbot availabilities that we're going to look at from Mississippi and North Dakota. So we'll be looking at that next time, as well as what other state boards of nursing are doing to help a small staff and very, very busy staff in that respect. The next item was X-rays and APRN ordering and the current KDHE regulations, as well as what we can do to help facilitate the next steps there, which that'll be on our December agenda. And then the third piece was business operations and nursing. And, you know, we heard from Linda the different requests and phone calls that she gets. And this one is in relation to ketamine clinics. And so we want to have a better understanding of what's happening in other states, as well as like what our jurisdiction is in that respect. Unfinished business was looking at our regulation review process. We're actually going to start that in December. And we had an executive session on certified professional midwife. We recognize that we have been having this discussion for almost a year. And so we intend to wrap that up very soon. Just really trying to determine what our play is or what our jurisdiction is in that particular case, as well as addressing any outstanding request for information and the origination point. We heard from a school nurse, somebody that Linda actually got to meet at the nursing conference that she was at. And so we are looking at delegation of tasks in the school setting, 2 specific things. The first one being mechanical ventilation. The second one being G tube, J tube, and some of the language around that that's existing. So the committee has some documents to review that were provided, as well as looking at research from other states. There was one other one. Perhaps the position statement from NSBN.
Oh, on the IV hydration.
That was IV hydration.
They just recently put that
That
out.
was the other one. Correct. And then we got to hear from Carol regarding their IV therapy task force. So as we heard, we will definitely be learning more about that and listening to that. That we had no motions. So that is good.
And I'm trying to go to
We'll move to the finance and risk management committee report.
I don't have any motions from the finance committee. We did review just the agency finance report, sort of an update on final changes happening in the fiscal year 26-27, which are due very soon with the Carol. talked about the LP cybersecurity assessment, and then some licensing. So lots of the pieces that we discussed or we heard from Adrian in his report, and as well as the 5-year statute regulation review, which we'll discuss, or that's a full committee or a full board years. So. I'll return. I'm wondering if we maybe have an opportunity to go into an executive session
That much.
before we would then come back and have a break for lunch.
Yeah, it's supposed to be on its way here. So I haven't heard if it's here yet, but we could do that.
So there's a request for a break before we do that.
Yeah.
So, timing is usually if these restrooms are closed during our break. You'll need to look to close. But, so let's have a quick, let's break until 11:30, and then we'll come back, and then we can decide on executive session. And do everything. So. Okay, thanks. So we're back from our break and we have a motion for executive session.
Pursuant to KSA 75-4319 B2, I move that the board recess into executive session for 10 minutes and reconvene at 11:42. By the time I finish. The meeting will reconvene in room 509 in the Wayne State Office Building and remotely by Zoom as stated in the notice of the meeting that was sent to individuals who requested the notice and is published on the board's website at www.ksbn.kansas.gov. The justification is consultation with the board's legal counsel, assistant attorneys, General Charles Matiers and Jesse Burris, that would be deemed privileged in the attorney-client relationship. The subject matter to be discussed in the executive session concerns legal issues related to internal procedures and statutory compliance. The board's executive administrator, Carol Moreland, and Adrian Guerrero are included as the client.
We have a motion. Is there a second? Thank you. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Okay, motion carries. So we'll go.
Make sure you
Okay, thank you. So we're back in session after our executive session. Thanks, everyone, and you're gonna break for lunch. So we will take 30 minutes. Can we come back?
We'd like to get a picture of all the board too, since we got a new.
The board members.
Okay,
So, and then also if you can leave your laptops down here, Tony needs to come load some security software on your computer. Some, I don't know which ones.
But we will make sure there's at least one step.
So do we need to stay signed in for him? to sign
Yeah,
in
you can
and
just leave it where you're at.
seal? Okay.
That may lock it.
so let's say that we will come back in at 12:20. That'll allow everybody time to get up and go picture. So we'll be back in session at 12:20.
And lunch is upstairs, and you gotta take the north elevators. But I think it's ready.
This is ready.
Okay,
She
so.
looks so
Well, we'll be back. Cool.
All right.
Okay, thank you. So we're gonna come back in session. I apologize for, our lateness in coming back in session. So we're gonna move to unfinished business. First is, LPA on evaluating state agency registries, et cetera. Carol?
Sure, thank you. It starts on page 26, and I actually put the report in there because we've had the committee meeting and the report out and everything on this, so this is off their website, so it is public information. Just a little history here, this actually came up because they felt like it was very difficult to find information from some of the agencies about maybe who had been disciplined for abuse, neglect, or exploitation. Such as, like, if the public wanted to know that information, how easy is it to find that information? What's the process that you use, for complaints and stuff like that? Their biggest focus was on KDHE, KDADS, and another big one. Protective services, adult protective services. But they brought 3 licensing boards in. They brought the Board of Healing Arts, they brought Behavioral Sciences, and they brought us in. And a lot of our questions had to do with how do we get complaints? If we have a complaint that maybe came in on a CNA, which of course we do not have any authority, what do we do with that complaint? And stuff like that. Actually, there was no recommendation for KSBN that they change their procedure, anything that we're doing, because right now, if we discipline somebody for abuse, neglect, or exploitation, it would show up in our discipline case list. So you wouldn't have anything that just sticks out that says like abuse and have names listed. Again, they didn't say that we had to change or anything like that, but it's not real easy to perhaps find that information. It's out there, but it's not always as easily identified. Because if you go to KDADS, they kind of like change theirs, and you can actually, it's pretty easy to find it. So, I think maybe it would stay low on the, with everything going on, but it might be something to think about. I don't know if they'll ever come to the point where they'll pass, some statute or something that tells all the agencies exactly that we have to do them all the same. I didn't hear anything like that, but it's kind of interesting to read it. But we did okay on that one. Is there anything?
How about the KSA 74-1112 draft revision?
Right, that's on page 54 and 55. If you remember, this came out of the FBI audit that we had in March, I think. We thought we had statutory authority to do criminal background checks on APRNs, because actually in the statute, an APRN statute, I can't remember which one off the top of my head, but anyway, it said that we could do rules and regs. It's actually in rules and regs that we can do the background check for APRNs. But according to the FBI, that is not statutory authority. So 74-1112 is the statute that gives us the authority to do fingerprints and background checks on all the rest of the applicants. So the suggestion was that we revise this just to add the language of advanced practice registered nurse and registered nurse anesthetist. So I did work with KBI, and what you have in front of you is their suggestion for changes. Right now, we have a memorandum of understanding agreement, I can't remember which one, with the KBI so that we can do state background checks on the APRNs, but we can't do federal unless they happen to have an RN application at the same time, because we can do it for RNs. So I just brought this for you to look at. If you're okay with it, you know, I can start with the revisor and start working on this. Hopefully we won't meet much opposition, because it'd be really nice to be able to get this changed. But it's pretty straightforward, actually. But not everything's straightforward nowadays. So, any questions or?
Do we have a process for proposing this, or who's going to carry this on our behalf?
We haven't yet. I need to think about that. I don't know if Melissa can give us any advice.
I thought we should, does this not just go through? We're just asking to update. What do you mean carries?
We are
It's
just
gonna carry
asking,
it in the legislature.
we are asking to update by adding APRNs and the registered nurse anesthetist.
Okay,
So the statute would have to be changed.
it'd have to be changed and that goes into the bill process if I'm understanding that correctly. Okay,
So maybe we can talk,
yeah, we should talk.
because I presume it probably would go in a health committee. There was in hopes there wouldn't be much questions or anything, but I'm not sure about this. Okay, I will start that.
So I think this statute update flows nicely into really the five-year review process. And I think it would be helpful, Carol, if you just kind of remind us all as we look at the review of statutes and regulations, while we can make changes to regulations, they all have to speak to the statutory authority, and any statute changes would need to go to the legislature for approval. So just, I think, kind of keeping that in mind as we think about rules and regulations that we may set forth, they all have to fall under the approved statutes that are in place. Is that correct?
Yeah, that's part of the approval process is, it goes to the Attorney General's office. And they look at the statutes and everything that we refer to on them and make sure that those statutes do give us the statutory authority to do what we want in that regulation. So, yes, the Board of Nursing has the final approval of rules and regs, and I know that's what's a little controversial. However, it's not like you just think of these and they never have to be checked out by anybody else. That's not how this goes. There's a process they go through. The process does involve a 60-day public comment period. During that 60-day public comment period, I have to go over to the Joint Committee on Administrative Rules and Regs and present those. That's interesting sometimes, depending on what it is. It may be a little trickier now, but so that's where they can give feedback because they always provide written feedback, such as no concern or something. But I know from some other agencies, they have come back and their comment has been that the agency should not adopt these. However, some of them, the agencies went ahead and adopted it. So that, at that point, that becomes your decision. But there is a check to make sure that the statutes allow us to do it.
And if I could add, so in every regulation at the bottom, there's a history section and there's an enabling statute and an authorizing statute. So every reg has that. Mostly what we're doing is amending existing regulations, but they still review it like it's a new reg every time. But so generally, it's probably safe to say that the little immaterial revisions we're making are authorized by the statutes.
I have a question. For the advanced practice registered nurse and registered nurse anesthetist, are they not already professional nurses? Why do we have to fingerprint and background them again?
Because not all of them, as Ray was talking about, would be submitting an RN application at the same time. We run into a lot that they may have a multi-state from Missouri, but they want to function as an APRN in Kansas. Okay, we require that they have an active RN license, but that active RN license is not through us. And part of the compact, I can't remember the exact year that they changed to the new compact, but when they changed to the new compact, the states that were already in the compact were able to grandfather their nurses in, which means they didn't have to get fingerprints and a background check. That was one of the new things in the new compact. So you might see somebody that has a multi-state license from one of those older states who was grandfathered in. And as long as they renew their license on time and stuff like that, they do not have to do fingerprints and a background check there. But if their license ever expires and they want to reinstate it, yes, they have to. So does that answer your question?
Yes, thank you.
So do you want to just kind of, I know we've spoken about this in many of the committees, but just
Yeah, this is just the combination. We talked about this last time. We wanted to take the old 5-year legislative review process that we did that covered both regulations and statutes and take the new process that looks at regulations that we have to do every 5 years and submit this report to the legislature. If we just submitted that report this year, so the next one probably would be in 2030 unless they change it. We wanted to put those together so that we really have just one review process. And so what Andy did is you'll see when you look through this that these are divided by committees. So we've talked to each committee, and I know what some of them are doing is, like in December, they have asked me to put all of their 2026 on their agenda, and then they can tell me, okay, which ones they want to start looking at in March. So I can put those in their March packet. That's one way of doing it. You know, we've kind of left it up to committee as far as how they do those within that year, but they have to be done within that year. Like 2026, they have to be looked at within 2026. Same thing for 2027, 2028, 2029. But you remember the last time for this report of the legislature, you had to answer some questions. You know, does it contribute to public safety? Some of those, could it be revoked? What would happen if it was revoked? We're still gonna have to answer those because, on the regs, because that is what has to be reported back. We do not on the statute, but these do have regs and statutes in them. Does that make sense to everybody?
I just want to be clear. We're doing the statute review every 5 years as a best practice, or we're required to do that by the legislature?
No, best practice. We've been doing that for years. Yeah.
And we just did the reg review, but was that not all of the regs, or just wasn't in context of those?
It was all the regs, but we have to do it then for 2030 when we do that report. So we could leave a whole bunch of regs and then you guys have to do them within a short period of time, kind of like we did last time. I think we did them within maybe 2 years, something like that.
I'm just trying to determine, are we redoing all that reg work that we just did?
They're gonna require us to.
We have to every 5
Before
years.
2030
2030 is when the next one is submitted. I think I'm looking at Andy, but it's every 5 years.
Yes, ma'am.
And we just submitted it, so we'll have to go through all of our regs by 2030.
Okay. I just wonder if we're already gonna be reviewing some other statutes and then these statutes, and how much can we realistically do as a board in 2026? I'm trying to determine.
I mean, if the board wants to do it a little bit different way, that's your choice.
I don't know that I have a better way. I'm just trying to understand the workload here.
Right,
So,
right, definitely. Yeah, it is a lot. Some of the committees have a lot. You know, if the committee is, if you feel like there's enough on the plate for 2026 and you just want to wait and start this in 2027 or something, that's your choice. They just have to be done by 2030.
I mean, I might just offer one alternative would be depending on the work that's happening in the different committees. You know, really for like CNIB, our committee spoke that there have been different regulations that have come up in conversation. And so we may reprioritize along the way what's reviewed at different times, based on where we are in discussion or feel that any updates or changes will need to be made. In that same sort of idea, I would think that committees could defer. So if you have some on, like, let's say you have 2026 regulations, but you find that you are specifically working on, like, for investigative, you have this task force looking at statutes that could then also have to trickle down impact in other areas. So if for the investigative, it makes sense as you meet back to defer any activity in 2026 and move everything off to 2027. I mean, I think it's just, my interpretation is sort of a guideline to get the process moving so that as a board and committees as a whole, we aren't spending that much time in that 2 years, 18 months prior to trying to work our way through to trying to parcel it out. But if it doesn't fit into the priorities of the workload at that time, I don't think
I don't think you have to.
mandatory. That's how I
Yeah.
see that.
I'm wondering, Linda, from your perspective, the statutes that we are looking at as a work group, how much crossover is there with these from 2026, or is it all, did you do that?
I did that. 5 of the ones that we're looking at in the work group are on for 2026. There's only one that's not. And then the proposed impairment statute that is not a statute
So
currently.
this would kill two
Those-
birds with one stone.
It would kill 2
essentially.
birds with one stone. We could move a couple off and move the 2 that are not on to go at the same
Okay,
time as the
that's
rest of
helpful.
these. That way we review them. Whether or not then the committee decides to do all of them, prioritize all of them at once, or just kind of like work on a few. That's up to the committee.
Any other questions? Right. We will move on to new business. I'd like to just reorganize how these are listed on our agenda. And election of officers and delegation motions to the end. And so, if we could start with end of life licensing software, that would be great.
Sure. Thank you. This should be real quick. It's June 30th of 2027. We have to be off our current platform, which is My License Office. As you heard a little bit earlier, we're working towards getting quotes and those sorts of things. We're going to bring them to the Finance and Risk Committee in December and potentially, you know, assuming we have all everything, have some potential proposals so that we can start our path. So basically it.
And then updates on KAR 60-3-102 and 60-7-102.
Yeah, those are actually on page 66 and 67. And the reason I put these in there is because, you know, we're supposed to be looking at, is there any regulations that we can revoke because of practice changes or whatever? We don't actually do duplicate of initial licenses. We don't issue the paper, the card licenses anymore, anything like that. Now, if they want to, they can go to our website and print one off. However, we don't do duplicate license anymore. So perhaps these 2 could be revoked. I mean, it's just a thought, because we don't do it.
And there used to be a fee for it, but we just embedded it in and made it free back in,
And I think it may show up still on the fee regulation. So that'd be something else for the check.
it's really available for them. So.
Yeah.
So that is something that, well, first let me ask. Motion on that.
The process, I believe, is very similar in that they've kind of changed this and we don't revoke very many, but I think you still have to have like the 60-day comment period and everything like that. So everyone could weigh in on what would be the impact if these were revoked. Yeah, we haven't done this for several years. We haven't done duplicate licenses, so know that there would be much, but anyway.
When you submit that for public comment, do you get to have comments in the company?
We can, anybody can do it. Anybody can give, they can do comments to me during that 60 days, just, you know, send me an email or something like that. And then the public notice is open. We usually do it, probably these, we would do it by conference call because I don't think you have that many people come in person. And then they can give a verbal and follow up with the written comments. But then all the comments that I receive, including, I presume we probably have to take these revocation over to the joint committee. But all of those comments then go back to the board so that you have an opportunity to see the comments that have been submitted before you make the final decision that, yes, we want to revoke these.
And I guess I should have reframed the question. So I'm thinking context. Do you get to provide context when you put something like this forth for revocation? Like our rationale, like why we're doing it?
Yeah. So I think we have to do an economic impact statement, maybe still with revocation. Again, we don't revoke anything. But that is part of it, you know, is why do we want to do this?
The revised AR 60.
Yes, as a revised, but we really want to revoke.
True.
Right?
Yes.
Okay, I move to revoke KAR 60-3-102 and KAR 60-7-102 to just leave it there, yes. You reread that. I move to revoke KAR 60-3-102 and KAR 60-7-102.
Sharp second. We have a motion on a second. Is there any discussion? Okay, all those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? So. Consider, yes.
We're trying to get a integration.
They're coming down.
They're coming down.
Mhm.
Okay.
Madam President, pursuant to KSA 75-4319B2, I move that the board recess into executive session for 60 minutes and reconvene at 1:55 PM. The meeting will reconvene in room 509 Landon State Office Building and remotely by Zoom as stated in the notice of the meeting that was sent to individuals who requested the notice and is published on the board's website at www.ksbn.kansas.gov. The justification is consultation with the board's legal counsel, assistant attorneys general Charles Natchers, Jesse Burris, Sydney Winslow, Samantha Harrington, and Rachel Kinney Townsend that would be deemed privileged in the attorney-client relationship. The subject matter to be discussed in the executive session concerns legal issues related to internal procedures and statutory compliance. The board's executive administrator, Carol Moreland, Linda Davies, and Adrian Guerrero are included as one.
Motion, is there a second?
Second.
Discussion. All those in favor say yes.
Yes.
No. Abstentions? Motion carries. Please a reminder to make sure you're logged out.
We'll be back. Oh.
So we're gonna go ahead and take a motion here for an extended executive session.
Pursuant to KSA 75-4319 B2, I move that the board recess into executive session for 60 minutes and reconvene at 2:55 PM. The meeting will reconvene in room 509 Raymond State Office Building and remotely by Zoom as stated in the notice of the meeting that was sent to individuals who requested the notice and is published in the board's website at www.ksbn.kansas.gov. The justification is consultation with the board's legal counsel, assistant attorneys, General Charles Matiers, Jesse Burris, Sydney Winzo, Samantha Harrington, and Rachel Kenny Townsend. That would be deemed privilege in the attorney-client relationship. The subject matter to be discussed in the executive session concerns legal issues related to internal procedures and statutory compliance. The board's executive administrator, Karen Moreland, Linda Davies, and Adrian Guerrero are included in the client. As the client.
We have a motion, is there a second?
Andrew Goldsmith, board member, I second.
Motion and seconded, any discussion? All those in favor say yes.
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 Anyone opposed, no. Any abstentions? Motion carries.
Either.
So we're back from executive session and we have a motion.
Madam Chair, I move that the board delegate to the chair the authority to review and approve an internal policy regarding cases with evidence of violation of KSA 65-1120 and KAR 60-3-110, Section W, to be ratified by the board in the December 2025 meeting.
Here's a motion. Is there a second?
Have you voted for board member second?
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. I'm going to abstain. So, next on our agenda, we do have, election of officers. And so, opening it to the board for, so we have positions of president, vice president, and secretary. So. Start with, I'm sure.
Let's start with president. I would like to nominate Andrea Watson.
Sharp, second.
All in favor, say aye. We did this to her the last time too, so don't worry. I'm crying, it's all right.
Any discussion? Okay, so anyone opposed? I'm gonna abstain. Thank you for your confidence. So I'd like to open it up for vice president nominations.
And I did check on this first, and I'd like to nominate Steve Peterson. He has a lot of leadership ability outside of the board, and I think that he could be well trained to back us up as vice president.
I second.
Awesome. Any discussion? I'm giving you an opportunity. All those in favor say yes.
Yes.
Anyone opposed, no.
I abstain.
Great. It's a great job. And so I'll open it up for secretary nominations.
And I nominate Michelle Houston. Am I saying it right?
Yeah.
Terry. Where did I get Houston? I don't know, I like that last name.
Michaela.
Michaela. Oh, I got him.
Yeah.
I
He's not here.
apologize, but that's who. Yes. We've also done work. Yeah.
I second.
For discussion. All those in favor? All those voting for Michelle say yes.
Yes.
Opposed? Abstain. Okay, great. Thanks, everyone.
Once again, we had a successful election.
And so just need a moment to get our delegations in order. So if I can maybe skip ahead while we're waiting on the clarification on some of those delegations. We just discuss quickly our agenda items for December. We know that we should have an update on the audit presentation to the committee. We will discuss again our 5-year combined statute and regulation review process. What else is on there?
I can report back on 74-11-12, kind of where we're at with that. If you want me to.
Great. The other things at the moment. Okay. Let's just give it one moment for. So next, we will have our annual delegation motions. Ready?
I move that pursuant to KSA 2023 supplement 77-527 of the Kansas Administrative Procedure Act, the board designate and delegate to board president its authority as agency head to review, decide, and issue any orders concerning petitions for review, petitions for reconsideration, and motions for stay filed with the board, and taking any other action related thereto until further action by the board.
Is there a second?
Burkhart said.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any other abstentions? Motion carries.
I move that should board president be unable to serve as agency head, the board designate vice president to serve as an alternate agency head. And in such circumstances, the board delegate vice president its authority pursuant to KSA 2023 supplement 77 to 527 of the Kansas Administrative Procedure Act to review, decide, and issue any orders concerning petitions for review, petitions for consideration, and motions for stay filed with the board, and taking any other action related thereto until further action by the board.
Is there a second? Sharp, second. Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
I move that the board designate and delegate to the chair of the investigative committee the board's authority to, one, make a reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto to the Kansas Nurse Practice Act regarding matters that have recommended for emergency proceedings by staff or council, and number two, act as presiding officer pursuant to KSA 77-514G and 77-551A and C, and amendments thereto of the Kansas Administrative Procedures Act to conduct emergency proceedings and issue an order as required by KSA 77-536 on all matters that are being or have been investigated or any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder, unless the chair of the investigative committee determines the emergency proceeding should be conducted and decided by the investigative committee.
Is there a second?
Right, second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion passes.
And what was that for each of them? Subject to motion number 27 regarding delegation to the chair of the investigative committee, I move that if the chair of the investigative committee is not available to act as described in motion number 27, the vice chair of the investigative committee is so designated and delegated to act as described in motion number 27.
Motion, is there a second?
Second.
Discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries. Sorry that you have to keep hearing my voice. I move that the board designate and delegate to the chair of the investigative committee the board's authority to, one, issue to an applicant meeting the qualifications and requirements of the Kansas Nurse Practice Act and the Nurse Licensure Compact Act, any license, certification, qualification, or authorization to practice nursing. Two, conduct hearings, enter into settlements, issue and amend decisions regarding the assessment of fines pursuant to KSA 74-1110 and amendments thereto involving an allegation that a person who submitted an initial renewal endorsement or reinstatement application for any license, certificate, or qualification or authorization to practice nursing has violated or not complied with the Kansas Nurse Practice Act or regulations adopted thereunder. Three,
make a reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto regarding applications that are being investigated or have been investigated for any alleged violation of or compliance with Kansas Nurse Practice Act or regulations promulgated thereunder by the board. 4, order applicants to complete evaluation by the board's impaired provider committee pursuant to KSA 65-4924A and D. 5, act as presiding officer pursuant to KSA 77-514G and 77-551A and C and amendments thereto the Kansas Administrative Procedures Act to review, decide, issue, and amend any orders on matters involving all applications, whether initial renewal, endorsement, or reinstatement for any license, certificate, or qualification or authorization to practice nursing that have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. Such delegation includes, but is not limited to, sending warning or recommended letters, entering into settlement agreements, conducting KAPA proceedings and hearings, issuing pre-hearing orders, and issuing initial orders denying or imposing limitations on any license, certificate, or authorization to practice nursing under the Kansas Nurse Practice Act, and taking any other action related thereto, unless the president determines that the matter should be sent to the Office of Administrative Hearings for further proceedings or considered and decided by the investigative committee. And finally, 6, review and approve or deny an applicant's request to receive accommodations while taking a board-approved nurse licensure exam and/or the NCLEX exam.
You have a motion, is there a second?
I'll second.
Discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Abstentions, motion carries.
Just say 29. Subject to motion 29 regarding delegation to the chair of the investigation committee, I move that if the chair is not available, the vice chair of the investigative committee is so designated and delegated to act as described in motion number 29.
You have a motion, is there a second? Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Motion carries.
The 30 and the 30. Is that just 29? 29 is the first one. I'm sorry, 7. And yes, 27. Subject to motion number 29 regarding delegation of applications and motion 27 regarding delegation of emergency proceedings, I move that the board designate and delegate to the investigative committee its authority by 1, conduct hearings, enter into settlements, issue and amend decisions regarding the assessment of fines pursuant to KSA 74-1110 and amendments thereto involving an allegation that a person who was granted a license, certificate of qualification, or authorization to practice nursing has violated or not complied with limitation pursuant to KSA 65-1120B and amendments thereto of the Kansas Nurse Practice Act regarding persons who are granted a license, certificate of qualification, or authorization to practice nursing and are being investigated or have been investigated for any alleged violation or of compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. And 3, order licensing a complete evaluation by the board's impaired provider committee pursuant to KSA 65-4924A and D. Number 4, act as presiding officer pursuant to KSA 2018 supplement 77-514G and 77-551A and C and amendments thereto of the Kansas Administrative Procedures Act to review, decide, issue, and then any all orders on all matters that have been investigated for any alleged violation of or compliance with the Kansas Nurse Practice Act or regulations adopted thereunder. Such delegation includes, but is not limited to, sending warning or recommend letters, entering into settlement agreements, conducting reviews, proceeding in hearings, issuing pre-hearing orders, issuing initial orders that censure, revoke, limit, or suspend any license, certificate, or authorization to practice nursing under the Kansas Nurse Practice Act, and taking any other action related thereto unless the investigative committee determines that the matter should be sent to the Office of Administrative Hearings for conducting further proceedings and issuing an initial order or considered and decided by the board.
Give a motion, is there a second?
Second, Melissa Rapaza.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
I move that should a board member serving on the investigative committee be unable to serve as presiding officer in a matter pending before the investigative committee, the secretary is designated and delegated as an alternate presiding office of the investigative committee and not pending.
Have a motion, is there a second?
Burkhart, second.
Discussion? All those in favor say yes.
Yes.
Anyone opposed, no. Any abstentions? Motion carries.
Two left. I move that the board designate and delegate to the chair of the investigative committee the board's authority to, one, conduct hearings enter into settlements and issue decisions regarding the assessment of fines pursuant to KSA 74-1110 and amendments thereto, involving an allegation that a licensee has violated or not complied with the Kansas Nurse Practice Act or regulations adopted thereunder for failing to submit to a mental or physical examination or an alcohol or drug screening or any combination of these, when so ordered by the board pursuant to KSA 65-4924, or failing to complete the requirements of the impaired provider program of the board, or for failing to meet the requirements of the nurse licensure compact. 2, make a reasonable grounds determination pursuant to KSA 65-1120B and amendments thereto regarding licensees that are being investigated or have been investigated for failing to submit to a mental or physical examination or an alcohol or drug screen or any combination of these, when so ordered by the board pursuant to KSA 65-4924, or failing to complete the requirements of the impaired provider program of the board, or for failing to meet the requirements of the nurse licensure compact. And 3, act as presiding officer pursuant to KSA 77-514G and 77-551A and C, and amendments thereto of the Kansas Administrative Procedures Act to review, decide, and issue any orders on matters involving all licensees that have been investigated for any alleged violation of or noncompliance with the Kansas Nurse Practice Act or regulations adopted thereunder regarding the failure to submit to a mental or physical examination or an alcohol or drug screen or any combination of these, when so ordered by the board pursuant to KSA 65-4924, or failing to complete the requirements of the impaired provider program of the board, or for failing to meet the requirements of the nurse licensure compact. Such delegation includes, but is not limited to, sending warning or recommend letters, entering into settlement agreements, conducting KAPA proceedings and hearings, issuing pre-hearing orders, issuing initial orders denying or imposing limitations on any license, certificate, or authorization to practice nursing under the Kansas Nurse Practice Act, and taking any other action related thereto. Unless the president determines that the matter should be sent to the Office of Administrative Hearings for their proceedings or considered and decided by the investigative committee. Number 4, make referrals, cause evaluations, or grant requests for restrictions pursuant to KSA 65-4924. And number 5, review and approval denial requests from the board's impaired provider committee to approve a change in licensing program participation or requirements for the program.
You have a motion, is there a second?
Steve Peterson, second.
Any discussion? All those in favor say yes.
Yes.
Anyone opposed, no.
Pursuant to KSA 65-1120B, KSA 65-1166, KSA 74-1106B, I move the board designate and delegate to the executive administrator the board's authority to request documents pursuant to any matter being investigated by the board or their staff, including requests under the Privacy Act 5 USC 5528B7.
You have a motion, is there a second?
Post a second.
Any discussion? All those in favor say yes.
Yeah.
Yes.
Anyone opposed, no. Any abstentions? Motion carries. And that's the last of our delegations. Thank you. Well done. So we've gone over our agenda items for December board meeting. Else, and I think we are good to adjourn. Thank you.
Did you do the election?